Again, Prof, is there any relationship between increased use of antibiotics, as you mentioned earlier on, during pregnancy and childhood obesity and diabetes in later life?
Interesting. Before I attempt your question, let me use these platforms to say that drugs and medications might be avoided during pregnancy unless it is absolutely necessary and is prescribed.
Please say it again.
I just want to tell the public that, remind viewers that drugs should be avoided, medications should be avoided unless it is absolutely necessary in pregnancy, and it must be prescribed by a qualified medical doctor.
Sometimes the ladies are vomiting, they are in pain, and you are saying that if paracetamol can help, they shouldn't. Is that what you are saying?
This one, you didn't hear me right. I said, unless it is prescribed.
No. I have some in the box in the house.
No, you can't take that.
Okay.
You can't take that. It is, you see, most of the medications that we have, we look on the bottle and most of them is written, the effect on pregnancy is not, it has not been tested in pregnant women. The reason is simple. Because you can't do clinical trials of pregnant women. So most of the drugs that we take, we don't know their effect on the embryo, we don't know their effect on the fetus. And that is why you must avoid it unless it is absolutely necessary and unless it's prescribed. Especially during the first trimester, I'm talking about the first 3 months, where the embryo is dividing rapidly. Even antibiotics can affect the growth of the embryo.
The first 3 months of pregnancy
is quite dangerous, and we have to be careful. This one, I would wish that we take it seriously. We don't know what's going to happen. It's tested in animals, all right, but the effect that you get in animals is not always replicated in humans. So maybe it may be safe in animals, but not necessarily in humans. And that is why I'm saying that you should be careful. Talking about antibiotics and in their relation to obesity, Reverend, there is a report that children who have been delivered by cesarean section grow big, all right, by their 7th birthday or so, compared to the cohort that is delivered by natural delivery. If you take that point, I'll be very happy, because I'm going to develop that. The fact that children who are delivered by cesarean section, all right, grow bigger. And it is interesting, because when you go to the villages, most of the births are natural births, and we don't normally see people who are obese. You don't see that in the village, all right? The reason is simple. When you deliver through the normal birth canal, all right, the mother imparts microbes, all right, that are essential for the child to develop his or her immunity as well as metabolism. Is passed on from the mother to the child. If you use antibiotics, especially the third trimester, when you are getting to delivery, you destroy most, because normally you use broad-spectrum antibiotics. Broad-spectrum antibiotics, I mean those that are able to kill gram-negative and positive, all sorts of microorganisms. So the quality of the microbes that the mother delivers to the child is reduced considerably. And in that case, then, you can't stand, how do we call it, immunity. Your immunity is reduced. And some of these microbes are also involved in metabolism of substances, all right, in the body, especially carbohydrates, proteins, all right, carbohydrates especially that are related to diabetes. Even as we sit here, all right, we are harboring a lot of microbes. Reverend, are you surprised to hear that? We are harboring microbes, all right? But 90% of them are useful microbes that the child needs, all right, to be transferred from the mother so that his or her immunity can be developed. We did a little work all right, and from a hospital again in the Ashanti region. And it was a retrospective. And then we found that for the mothers who delivered in the hospital, about 65% of them obtained antibiotics during pregnancy. We did not see a relationship between the size of the babies, all right, and then the antibiotics. But we realized that those that received antibiotics, the children that were born, all right, had more unscheduled visits to the hospital. In other words, the immune system was very low. All right? And there is a study in New Zealand that has confirmed that if you give antibiotics to children, if you give antibiotics in pregnancy, by the 7th birthday, you find that the baby is bigger than, normal. So that is the link. You don't get enough microbes to be able to fight the body's defense mechanism, to be able to help in the metabolism of carbohydrates. That's the link between antibiotics and diabetes.